been serving the community for 17 years with both our adult day health care, and we've been designated as an Alzheimer Daycare Resource Center since 1999. And one of the things that we were finding in working with people that came to our adult day services program in more the moderate advanced stages of the disease, that there was a huge gap. And this was kind of before brain health was a big term like it is today. So we started an early stage program for people who were experienced early memory loss issues, who wanted to be really proactive, because we knew that physical activity, the socialization and mental engagement and cognitive workouts would be really important towards their well-being, and so that was the original model.
Here in Napa, it's really essential for me that my mom gets the care that she gets here, and it frees me up because I can get things done. But also I have peace of mind knowing that she's well taken care of, and I'm not stressing about her anymore, where I used to stress a lot when she was at home and she wasn't doing anything.
We started Mind Boosters in 2003. It's a program for people with either early stage Alzheimer's or mild cognitive impairment. When we started the program, we were trying to fill this gap, but then what we saw from the program was that one of the most positive therapeutic parts of the program, besides the cognitive workout and for people feeling really empowered that they were doing something positive for their own brain health, was the fact of social engagement.
One of the other important aspects of person-centered care is putting the person first and the disease second.
Being with other people where they didn't feel alone or could admit that, oh, I'm having one of those moments where I just can't remember something, and they didn't have to feel so ashamed about it because they were in a room full of people that had similar programs.
When I was first introduced to the 7 dimensions of wellness that NuStep this program is based on, it so reflected the 7 values of person-centered care. They just really integrated so beautifully together.
In person-centered care, we're really looking at a balanced relationship between the person who we're supporting and the person. So when you have a caregiver, it almost makes it appear that there's not reciprocity in the relationship, but in our center, the reciprocity, it's a mutual relationship between the people who participate in our program and our care partners.
And that's where we start with our care plans, is recognizing their uniqueness, knowing their life stories, and building individualized care plans around their life stories.
So every day that she's here is a blessing as far as we're concerned. She loves it, she's happy.
The NuStep Pinnacle Award is so important to the integration of our person-centered care program, because it really helps participants have hope and keep their hope. And that's something as a human being should never be taken away.
It really was validating in some ways for us to know that we were meeting those dimensions of wellness, but also for our community, it just really is going to help us up our game and even go further with the work. And we're really looking forward to collaborating with NuStep and their initiatives, because we know that they have a strong interest in brain health and active aging, and that's really what it's about. We want to have a community where people can actively age.